Good afternoon, I am Vicky McCullum with the Friday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information. Later on the show, we'll be chatting about a bylaw that the City of Cape Town wants to amend. The city wants its streets and public places bylaw to allow searches and seizures without a warrant in certain circumstances, the constitutionality of which has been called into question. Yesterday, we ran a story about an e-hailing driver who was shot and killed in Khayelitsha. Our headline, or lower third in TV terms, read Uber driver killed in Khayelitsha. This was inaccurate. We would like to offer an apology to Uber for the oversight. Moving to the news. It is day 43 of the national lockdown, and the current number of confirmed COVID-19 cases nationally stands at 8,232, with 3,153 recoveries and 161 deaths. The Western Cape tally currently stands at 4,049 confirmed cases of COVID-19, 1,333 recoveries and 76 deaths. Citizens will be allowed to move into new houses under the Level 4 lockdown restrictions until the 7th of June. That's the word from Cooperative Governance Minister Dr. Nkosazana Dlamini-Zuma. The relaxation in the regulations would only apply if someone bought a house before or during lockdown and the transfer was already facilitated. The same applies to finalized lease agreements. A permit will be required to move, which can be sourced at a police station. This is a once-off offer. 2 armed men were arrested by police after a robbery at a convenience store in the city's central business district. The suspects were believed to have stolen cigarettes worth thousands of rands. Police said the robbers stormed Friends Cafe on the corner of Long and Castle Streets in broad daylight and held up the shopkeeper at knife point. They stole 3 large bags of cigarette cartons, 2 cell phones, as well as cash and a watch. A third suspect is still at large. With the national lockdown eased to level 4, many South Africans are eager to get back to work, but for some, this will not be the case. Consulting Engineers South Africa said the country's public works infrastructure was in dire need of maintenance and development. The construction industry needed to get back into action, not just for economic reasons, but for the health and well-being of the country. Chief Executive Chris Campbell said failed infrastructure exacerbated the risk of COVID-19, especially when it came to water, wastewater treatment and sanitation. He said delayed work on water projects would have huge implications for disease control. The Western Cape is leading another province in the number of positive COVID-19 cases. Premier Alan Winde provided an update on the province's response to coronavirus at a digital press conference yesterday. He delivered a breakdown on deaths to date, adding that COVID-19 related deaths in the province stood at 1.8%, which was in line with the international data on the progression of the virus. As it stands now, the death rate is not higher in the Western Cape than it is elsewhere in the world and is likely to be the same rate countrywide.
If I can say that on the work that was done with all of those specialists here in the last while, really analyzing our death rate, and perhaps on the outset to say that it's come back to say that we had 1.8%, that in actual fact the initial tracking set by our scenario planning has shown us that that probably would be where we are, and that we are tracking with international norms. So I think that's the first thing. I mean, people don't really want to analyze and talk about death, but we need to do it because it's about understanding the numbers and making sure that you're on the right track. I do want to say that so many of the deaths that we've experienced in this province are linked to not just the COVID, but it's the comorbidities that go with it. And so you can see, and we'll put this up on the website as well, but HIV 13%, diabetes 34%, obesity 6%, hypertension 31%, previous TB 1%, cardiac 8%, kidney disease 3%, and chronic pulmonary disease 4%. One comorbidity 32%, but many having more than one and sometimes up to 4 comorbidities. I can also say that 41% had no comorbidities, but that's also where age came in. And of course, the analysis also breaks it down to age. And really it is an interesting piece of work, but it also shows us that we are on track. It also shows us very really where our risks are and who those people in our society are at risk. And you'll hear from Dr. Kluti and Minister Norma French and Bombo as to our focus inside those hotspots, how we really need to protect those vulnerable people in our society. Perhaps also just to say that 90% of people who test positive don't get to one of our hospitals. They are fine, they are asymptomatic, and they don't need to move into that level of healthcare. 10% enter into our hospital system, and 82% of those that enter into our hospital system come through the virus and go home again. So, of course, analyzing the death rate, but also showcasing that coming into our health system, the kind of work we're doing in the system, also enabling you to get well again and go home. Perhaps the last percentage I want to say is that we also test not only when you enter the system with COVID-19, we also do post-mortem tests, and we are showing now 11% now of our positives are actually post-mortem tests that we're doing, testing beforehand and even after death, so that we're getting the most accurate data that we can in this process.
Health Minister Department Head in the Western Cape, Dr. Keith Kluter, says the private sector would be brought into high speed up the turnaround time for COVID-19, to help speed rather. He made the announcement during a virtual press briefing. The province has conducted more than 50,000 tests thus far.
One of the most important things is to understand what happens with the deaths, and from that we've identified how we should focus our energy and our efforts on people that's most vulnerable. And therefore, one of the refinements we want to do in the community screening and testing is to have a special focus on people with comorbidities, a special focus on the elderly. So part of the health system preparedness is also to be refined in the way we go out and make sure that we find the most vulnerable and make sure that we protect them against the transmission of COVID. The second big point is, the Premier made, is at the peak, and what's happening now, there's 90% of people are not going to need hospitalization. So it's really preparing the system of how to deal with the people for which we make a diagnosis and they're well enough to be at home. So that part of the preparedness, a very important piece of work, is that we're scaling up more places where we will be able to do bigger amounts of testing, but we also don't want to do it in a way that exposes people. So one of the key innovations in that space is to identify the places and to also say that we prepare those places where we can do social distancing and we can make sure that we can screen and test. So I'm going to read out the places where we are preparing for these big, let's call it testing and triage centers. They are already in existence at Tygerberg Hospital, at Victoria Hospital, at Khayelitsha Hospital, at Karl Bremer Hospital, at Mitchells Plain Hospital, at Paarl Hospital, at New Somerset Hospital, at George Hospital, Westvliet Hospital in Atlantis, Eerste River Hospital, the Heideveld AEC, and in Kraaifontein CHC. In the following places we're busy preparing for those: at the Red Cross Children's Hospital, at False Bay, at Helderberg, at Worcester, in Grootskee, Mowbray Maternity, and the latest addition is Ceres Hospital, on the back of what has happened in Witzenberg. So these are the places we're preparing where we will be able to do testing and screening. An additional innovation is the isolation booths that we've also got in acceptance. We've got 5 of these. And this is not only at these places, but also in addition to this, there's a further 106 primary care facilities where we will also be doing testing. But the isolation booth, it's quite an innovative booth in that healthcare provider can take the samples from a patient or a person under investigation without coming to a direct contact with the person. So it's quite a useful innovation that the person can put on the gloves, get the sample, and there's a separation between the doctor or the clinician taking the specimen and the person under investigation. So those are very important ones, and that is preparing before somebody gets admitted. The biggest additional thing that we are preparing as a healthcare system, and we've seen this, you might have seen in the media, is working with our health workers, because we need to prepare our health workers for what's coming. And one of the big things is to accept the anxieties, is to be empathetic, and to reach out to our health workers. You would have seen the EMS workers in Khayelitsha about feeling unsafe. You would have seen, and we're aware, at Tygerberg Hospital, staff is feeling unsafe. At Karl Bremer Hospital, people are feeling unsafe. At primary care facilities in Khayelitsha, 2 or 3 of them, we have people where we have infections amongst healthcare workers. And the big thing is, do we have the PPE to be able, but it's not just the PPE. It's really going out of our way. We spent the last 3 hours this morning as well talking to our organized labor colleagues. It's really meeting our staff where their fears are. We're going to be doing in the next 2 weeks places of reaching out to our staff and talking to them, talk them through the fears, work with them, meet them halfway so that they feel listened to, they feel heard, and they feel supported, because they're going to be the most important part of what's coming at our way. After that comes the issue, what will we do with the increased number of cases, the ones that has to be admitted? For that, the Premier released last week that we have the Cape Town Convention Centre, and we're preparing for 850 beds of intermediate care in that facility. As of this Friday, we will be going on site to actually start with the renovations, and of next week, we will be seeing the unfolding of the preparation of that space. It will probably be the single biggest place where we will be hospitalizing people with COVID and looking after them in a concentrated way. In addition to that, we have 3 other additional places we're working on. We're busy getting the agreements in place, and we will be announcing that over the next 2 or 3 weeks to work up to a total of 1,400 beds in 3 additional places in the metro and an additional place in the Cape Winelands. The last thing I would like to say, one of the most innovative things that came out of the review that Minister Mbombo chaired with all our clinical colleagues is to look at innovative ways of managing COVID. There is so many different ways and learning across the world of how to manage COVID. 2 specific ones the clinicians were very excited sharing with us. One is something called proning. Proning is you manage the patient on their stomach. So instead of lying on your back like you normally would lie in a hospital bed, you lie on your stomach and you get oxygen administered from that. The early signs of that seems that that is a very good practice, and it improves the recovery for patients. So that's our team in Grootskee working very hard on that, and we're following very closely what happens with proning. The other one, which we're very excited about, is the use of high flow oxygen. So instead of putting the person on a ventilator, is to use high flow oxygen in a high care setting. And also there's some very good promising results coming out of those practices. So I would like to just conclude on that. The healthcare system of this province has always been in a good state. What we've been able to do with COVID is to raise our readiness to do this and be prepared for what's coming at us. We've also had very good cooperation with our private sector colleagues, and we're very close to having agreements that we will do this as a collective towards the peak of COVID.
Health MEC Noma French Mbombo says prevention is better than relying on healthcare. Let's take a look at her opening remarks from the provincial COVID-19 briefing.
80% of cases, positive cases, they are being managed at the primary healthcare level, which is at home. It's only about 10% or so that are being managed that are hospitalized. So therefore, it means that the COVID stays in our communities. And the first thing first is about prevention and promotion and also taking responsibility as communities. Because we cannot only rely on health only, when only the people only come to our health facilities only at a later stage for hospitalization. So what do we mean by the prevention? It's a responsibility of everyone, the whole of government, the all other departments, the whole of society. First of all, it's about, as Dr. Keith and also the Premier has indicated, the protective clothing. Department of Health provided the guidelines on what kind of the protective clothing you can be able to make use of in the workplace and also elsewhere. Starting with when you can wear the goggles, when you can wear the face shield, when you can wear your mask, and also when you can wear your gloves, and also when you can protect the body. But one protective clothing that is compulsory to everyone, it is the cloth mask. So it's irrespective whether you are in the health space, whether you are in the shops, whether you are anywhere, cloth mask is compulsory to everyone. And also secondly, it's about the issue of protecting the vulnerable groups in the community. As I indicated earlier, 80% of the COVID cases are being managed outside in the communities. Currently, we know that it is social grants, and there are many people, the older persons who are vulnerable, who are making use of these outlets. True, that is being managed by the National Department of Social Development. We are urging for the people to conduct social distancing, to help the elderly so that they don't have to be squashing there. So meaning the second part of protecting yourself is a social distancing. Wherever you are, in the shops, in the workplace, in what I've just mentioned now, it's important you keep 1.52 meters to 2 meters distance to prevent the spread of infection. The other part is simple, is the hand hygiene. Washing your hands every 20 minutes wherever you are, taking about the 20 seconds, and also using the sanitizers if you cannot able to wash your hands. And remember, when you put on your mask, you wash your hands first before, so that you cannot be able to contaminate your mask. Remember, again, you'll be touching everywhere. Surface hygiene is also important because wherever you touch, there might be also some of the COVID or other viruses or any other bacteria or other germs that are there. It's simple because people ask where I'm going to get the sanitizer from. Just icepe, le bleach, kunye nelita yamanzi. Or 5 mils of a teaspoon of a bleach into a 250 mils, which is a cup, where you can use and clean the whole of your surface. Again, it is important when you are ill, stay at home. Don't go and mix with other people. At the shops, make it a point, you sanitize your trolley, you keep a distance, and also make it a point that you don't touch everything that is in the shop. So we ask the communities that whilst health can do as much, whilst government can do as much, but at the end, the behavior is the one that will make us to determine whether we can be able to flatten the curve by making sure that we behave accordingly.
It's time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Vicky McCullum. We will be giving you the latest updates on the COVID-19 pandemic and sharing essential resources and information with you. The City of Cape Town's amendments to its streets, public places and prevention of noise nuisances bylaw has raised concerns for the residents of Cape Town. One of them is Sandra Dixon, an activist and Facebook group administrator of Stop COCT, who joins us on Skype to talk to Octavia Ndlovu.
Greetings to you, the viewers, and thank you so much, Vicky, for crossing over to me. I am joined with Sandra Dixon. Today we will be talking about the city's amendment to the public safety and prevention of noise bylaws that they have put into the public to comment before they pass it. I am joined by Sandra Dixon, who is an activist, and she is in many groups on Facebook in terms of letting the citizens of Cape Town voice their opinions on the city's actions. Sandra, thank you so much for joining us today. Sandra, can you please just tell us what do you think about this bylaw that the city wants to pass?
My thoughts on this bylaw is that with many other things that the city does, we are left in the dark. The public is basically left in the dark as to what exactly it is that the city is trying to do. There's a huge backlash in the media as well as on our Facebook groups and Stop COCT, the one that I administrate, where the general public is incredibly unhappy with what this bylaw is actually trying to promulgate.
I mean, exactly, Sandra. Like with the bylaw, it says that people can be arrested or premises or a person can be searched without a warrant. What is your take on that? Because I think it gives law enforcement officials to actually abuse that type of law.
Absolutely. So I just want to go back because I did quite a bit of research on this whole issue, and specifically the separation between the police, SAPS, which is on the national level, versus law enforcement and other officials that the city are actually employing. Now, according to our constitution, clause number 14, and if you would allow me, I want to read it out. It is about privacy, and our constitution says everyone has the right to privacy, which includes the right to not have A, their person or home searched, B, their property searched, C, their possessions seized, or D, the privacy of their communications infringed. If that is not clear enough to prove the unconstitutionality of this bylaw, then me as a person of the public basically lose all my faith that I have in our judicial system.
Okay, Sandra, in terms of this bylaw, obviously the city can't pass it without any backup from national government. So I believe in 2018, the Minister of Justice passed or amended some type of law for the city to go forward on this. Can you please touch more about that?
Right. In 2018, the Minister of Justice and Correctional Services gazetted a declaration of peace officers in terms of Section 334 of the Criminal Procedure Act. Now, what this means is that at a national level, the minister gave municipalities, and the description in it is that the promulgation was for a law enforcement officer appointed by a municipality. And via this promulgation and gazetted item, the date was specifically 19 October 2018, the minister gave municipalities and law enforcement specifically these powers which the city is now writing into their bylaw. Now, a couple of questions arise around this. Is why did the city wait 2 years to change their bylaw? And my answer to that is the city must have read the Constitution and maybe realized that it's unconstitutional. It was unconstitutional even by the minister to promulgate this. However, because nothing really happened, the city decided, well, let's implement it because it's very convenient to have all these powers in a bylaw to police us. And then just another point that I want to bring in is that in the specific wording of the bylaw, the city refers to an officer or a city official, which again will make the bylaw null and void because the powers are specifically given to law enforcement. So as the bylaws stand at the moment, the city will have to edit and change wherever they have official or city official or any wording like that. They'll have to change it to law enforcement because these powers does not apply to any city official the way the city wants to write the bylaw.
Okay. Well, Sandra, what is your advice, especially to citizens of the city of Cape Town that have just found out about this bylaw through the interview? What is your advice to them?
My advice is that people need to update themselves, read the newspaper articles and watch television programs like this one. I advise them to go to the city's website because in the Have Your Say section, people can comment for the next week or so still on this bylaw. But I advise them strongly to specifically refer to the Constitution because the city won't act if we don't give them sufficient reason why this bylaw is not legal. Its legal grounds are just not right. An alternative is to go to the website dearsouthafrica.co.za, and there we made it very easy for people to actually enter their comments, and each comment that's entered on that website gets sent to the city direct. So one does not have to use the cumbersome city website. They can also use dearsouthafrica.co.za to enter their comments. And I urge people to enter their comments and base it around our Constitution, because that is the only defense that we as members of the public has at the moment.
All right. Thank you so much, Sandra, for doing this interview with us and just giving us more insights on the bylaws wants to pass.
Thank you very much, and it's my pleasure, and thank you for highlighting the whole issue.
All right, it's a pleasure. Well, there you have it. That was Sandra. She is an activist, and she's also one of an admin on a Facebook group called Stop City of Cape Town. So the public has the 17th of May to draft their comments on this amendment. So I encourage our viewers to actually go ahead and look at this amendment and comment. Just let your voice be heard. Well, I'll be crossing back over to Vicky McCullen, who will lead us to other interviews.
We're taking a short break. When we come back, Octavia and Lovo will have the latest on social media.
Welcome back. Before the ad break, we had Vicky McCullen with the latest news. One of Africa's largest reputation management consultancies, Magna Carta, has created an animated PSA to educate people on the symptoms of COVID-19 and remind them to practice social distancing to prevent the spread of the new coronavirus infections.
Kusezandleni zakho ukuba uzikhusela njani kwimpilo nokhuseleko lwe-coronavirus wena, intsapho yakho kunye nabo osebenza nabo. Yintoni i-coronavirus, COVID-19? COVID-19 luhlobo lomkhuhlane abantu abazange babe nalo ngaphambili. Abantu abakwazi ukuwumela lo mkhuhlane futhi akukafunyanwa iyeza eluchanayo. COVID-19 iyasuleleka kodwa ayoyikisi njenge-SARS virus. Eyona ndlela yoyilumkela i-COVID-19 kukungadibani nabantu ngobuninzi babo. Sanukoyika, ukuzikhusela nguyena ndongqo wokuhlula le virus. Iindaba ezimnandi, abantu abaninzi amajoni abo omzimba akwimeko entle. Bakufumana nje umkhuhlana ongayindawo, bazikhusela ngokulandela le migaqo. Hlamba izandla zakho imizuzu ema-20 ngesephu. Ukuba ayikho isephu, sebenzisa isibulala-ntsholongwane esine-60% yotywala. Yeka ukubamba amehlo, impumlo kunye nomlomo kuba ngawona masango apho ingena khona intsholongwane. Coca indawo yakho yokusebenza, idesika, ikhitshi, itafile yentlangano, indawo yokutyela, usebenzise isepha, isibulala-ntsholongwane. Hlamba izandla zakho emva kokuba ubambe nantoni na njengecango, umnyango weteksi, ikhompyuta, nelayiti yombane nemali. Ukuzikhathalela ukwimeko entle yokulwa nentsholongwane. Ukuba ngaba amajoni wakho omzimba akwisimo esihle sempilo, lala ngokwaneleyo, yitya kakuhle, zilolonge, lwisa ingcinezelo yengqondo. Yeka ukuhamba okungabalulekanga eMzantsi Afrika nangaphesheya ukunqanda ukwanda kwentsholongwane. Kuxhomekeke kwihambo yakho, hlala endlini amalanga ali-14 emva kokushiya indawo apho yandileyo intsholongwane. Eyona nto ibalulekileyo. Nangona kunzima ukuba kude nabo abantu abafutshane kuwe, zama ukungadibani nezintlobo zakho, ukunxibelelana nikude kuko okulungeleyo kuwo wonke umntu ukuze sikhuseleke. Ukuba uyaphuma kwakho, zama ukuba ungadibani nabantu abaninzi. Wazi njani ukuba wosulelekile yile ntsholongwane? Amaphawu afana nowomkhuhlane, ukuphelelwa ngumphefumlo, izilonda enqaleni, ukhohlokhohlo olomileyo. Ukuba ngaba ubona ezi mpawu, suxhalaba. Ukuba nolwazi yiyona ndlela yokukhuseleka. Landela i-World Health Organization ukuba uhlale unolwazi nokuba unombuzo. Ungaqala ngokufunda ngokubanzi nge-COVID-19 ngokuthumela igama HI ku-0600 123 456 kuWhatsApp. Le video iqulunqwe yiMagna Carta Reputation Management Consultants kunye nabo basebenzisana nabo kwizwekazi iAfrika. Hlala ukhuselekile, unxulumene nabanye, usebenza, ujonge ikamva xa sizama ukudadela enxwemeni sonke.
And now for social media. Share your thoughts with us on Facebook, we are OurCityCT, and on Twitter at OurCityCT. These are the popular hashtags on Twitter today. Zuma. The Zumas. Father Jacob Zuma and son Duduzane Zuma took to Zoom this week to share all sorts of revelations, including Zuma's senior claim that Nasrec ANC election conference was won with money. The Zumas have launched their own YouTube channel. Lindiwe Sisulu. The Human Settlements Minister and a close advisee have been accused of allegedly targeting executives at Amatola Water and Lipele Northern Water because they are standing in the way of efforts to manipulate tenders and to appoint a well-connected company for drought relief programs. After the outbreak, we'll be crossing over to Vicky McCullen, who will share information and resources of places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned to Our City, the COVID show with me, Vicky McCullum. Before the ad break, Octavia and Lovu looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune in to Cape Town TV daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via email on ourcity@capetowntv.org. You can also call us on 021 448 0448. From me, Vicky McCullum and Octavia Ndlovu, have a great day. Goodbye.